Muhammad Nadeem. I am going to present endocrinology and topic is hypothyroidism. When the secretion of thyroid gland is decreases and the hormone is decreases. So thyroid gland. Thyroid gland is second largest endocrine gland in our body. It is butterfly shape and located at the base of our neck. We can see here in this diagram. This is our thyroid gland. So thyroid gland is controlled by the hypothalamus and pituitary gland, and these both two glands are located in our CNS in the brain. Function of thyroid gland is it stimulates and maintain metabolic process. So produce thyroid hormone T3 and T4. T3 is basically called triiodothyronine and T4 is called thyroxine. So these hormones regulate metabolism and affect the growth and function of the other system in our body. Parathyroid gland secrete parathyroid hormone to raise serum calcium level. Calcitonin. It is another important hormone secreted by thyroid gland and it is secreted in response to high plasma level of the calcium. It reduces the plasma level of the calcium by increasing its deposition in bone. And iodine. It is essential to synthesis of the thyroid gland hormone. Iodine is necessary to synthesize the thyroid hormone. It is mainly used by thyroid. Deficiency altered thyroid function. If deficiency of iodine occurs, so secretion of thyroid gland is altered. Iodine is ingested in the diet, absorbed, and its ions are converted to iodine molecules. If this is our iodine ion, maybe I plus 5, so it's converted into iodine molecule. Molecule react with tyrosine, it is an amino acid to form thyroid hormone. The T3 and T4. T4 is converted to T3 by peripheral organ like kidney, liver and spleen because T3 is 10 times more active or more faster than T4. Hormone thyroid stimulating hormone. It is pituitary hormone controlled by thyrotroponin releasing hormone called TRH from hypothalamus. Function to stimulate thyroid hormone production. It may enlarge thyroid, also called goiter, when under production or overproduction. When the production of thyroid gland is increases or decreases, then thyroid gland becomes enlarged and it is called goiter. High thyroid stimulating hormone indicate low thyroid hormone and it leads to hypothyroidism, and low thyroid stimulating indicate high thyroid hormone and it leads to hyperthyroidism. Hormone calcitonin and parathyroid hormone. Calcitonin and parathyroid produced by the thyroid to regulate serum calcium level. Calcitonin stimulate movements of the calcium into the bone and parathyroid hormone opposite effect of the calcitonin. Hypothyroidism under activity. Its prevalence is it affects 5 to 17% of the population. Female is more prone to male and it is found in higher cases like more than 60% of L or called I can say we can say it is mainly found in older people. Its type is Hashimoto's thyroiditis, post-operative hypothyroidism, postpartum hypothyroidism, and laterogenic hypothyroidism. Hyperthyroidism overactivity. Its prevalence it affects 5 to 17% of population. Here also female is more in this type of case is mainly found in female than male, and it is more common in younger person. Its type is thyroidostrom, Graves' disease, toxic thyroid nodules, and laterogenic hyperthyroidism. Thyroid function test. Thyroid function test stimulate thyroid stimulating hormone and free thyroxine FT4 are elevated in hyperthyroidism and decreases in hypothyroidism. So when we do thyroid function test in case of hyperthyroidism, in case of hypothyroidism, we see the TSH and FT4 are decreases. We can do also thyroid scanning, biopsy, and ultrasonography. In lab test, in case of hypothyroidism, we can see the FT4 is decreases and thyroid stimulating hormone is increases. It is opposite in case of hyperthyroidism. This is hyperthyroidism symptom. In hyperthyroidism symptom cases, we can see weight loss, tachycardia, bulging eye like this, and nervous and osseous, insomnia, intolerance of heat, and goiter. Increased appetite and dietary intake, weight loss, abnormal muscular fragility and weakness, amenorrhea, changes in the bowel function, elevation of systolic blood pressure, arterial fibrillation, and osteoporosis and fracture also. This fracture, these all are symptoms. Goiter, a diet deficiency in iodine. If our diet, iodine is decreases, then then maybe we are suffering from goiter. Increase in thyroid stimulating hormone in response to a defect in normal hormone synthesis within the thyroid gland. Here we can see in this diagram the thyroid gland is hugely increases. Hyperthyroidism treatment, drug therapy, anti-thyroids, methimazole, and reduce the production of T3 and T4 in case of hyper, and its dose. Methimazole adverse effect, skin rashes, loss of taste, gastrointestinal upset, and drowsiness, decreased platelets. Carbimazole and its dose. Our topic is hypothyroidism. So its type, primary hypothyroidism most commonly cause failure of thyroid gland, occurs primarily in women aged 30 to 50 years old. Chronic autoimmune thyroiditis or Hashimoto disease is the most common primary hypothyroidism and hypothyroidism overall. Secondary hypothyroidism, tertiary hypothyroidism, and some other causes. Its symptom is fatigue, depression, bradycardia, constipation, and intolerance to cold in case of hypo. But in case of hyper, intolerance to temperature, heat intolerance occurs in hyper. Hypothyroidism primarily drug induced, PTU and methimazole, and laterogenic surgical removal of thyroid gland and radiation treatment in this case. Secondary hypothyroidism, pituitary failure, insufficient thyroid stimulating hormone release as a result of pituitary tumor, surgery, pituitary radiation, and pituitary necrosis, and autoimmune mechanism. Tertiary hypothyroidism, hypothalamic failure, it is seen in very rare, insufficient thyroid releasing hormone as a result of trauma, irradiation, and tumors. Hypothyroidism treatment, drug therapy like levothyroxine sodium drug of choice, synthetic thyroxine. In case of adult, 1 to 1.5 1 to 1.5 microgram per kg per day orally initially and adjust as needed. Average dose 1.5 to 1.6 microgram per kg per day. This is related to pediatrics. Thank you.